Good day. My name is Jacqueline Stenson. I'm the Manager of Projects at the USC Center for Health Journalism. Thank you for joining us for our Health Matters webinar, Can the Child Welfare System Be Saved? Today, we're going to take a closer look at some of the deep inequities and problems that have long plagued child welfare agencies in this country, as well as newer thinking on how we might remedy those flaws and tell impactful stories. Roughly 3 million children are investigated or trigger an agency response every year, but not all children are impacted equally. More than half of all Black children in the U.S. experience a Child Protective Services investigation. That's compared to less than a third of white children. Many families become entangled in the system after allegations of neglect, which can become a kitchen sink category for everything from poverty to substance use. A number of federal and state reforms have sought to address some of these problems in recent years, but as we'll hear from our speakers today, much work remains to be done to keep families together and offer the kind of supports that can help them avoid system involvement. And for journalists, the opportunities for deeper coverage are great. Here to help us wrap our heads around the current state of the child welfare system, efforts to drive change, and how journalists can approach this beat, we have three distinguished panelists. Roxana Asgharian is a Dallas-based independent journalist who writes about child welfare and the law. Her 2023 book, We Were Once a Family: Love, Death, and Child Removal in America, explores the flaws of today's foster system and won the National Book Critics Circle Award for Nonfiction, and most recently, the Los Angeles Times Book Prize in the category of current interest. Previously, she was the law and courts reporter for the Texas Tribune from 2022 to 2023. She is a native of Los Angeles and got her bachelor's degree in journalism from the University of Texas at Austin and her master's degree from the Craig Newmark School of Journalism at the City University of New York. Sisto Cancel is the founder and CEO of Think of Us, a nonprofit dedicated to transforming the child welfare system. He is responsible for leading the organization's strategy to drive change in child welfare systems across the country. Cancel incorporated Think of Us in 2017 as a tech nonprofit, drawing on his lived experience growing up and aging out of the child welfare system. He was named a 2021 Children's Bureau Champion Award and 2017 Forbes Top 30 Under 30 Social Entrepreneur, among other honors. Juyun Chang is the Program Director for Child Wellbeing at the Doris Duke Foundation, where she oversees the program's grant-making to promote children's healthy development and protect them from abuse and neglect. She previously served as Acting Assistant Secretary and Principal Deputy Assistant Secretary for the Administration for Children and Families of the U.S. Department of Health and Human Services, where she was the top federal official overseeing the implementation of national child welfare policy. Before that, she led the state of Michigan's child welfare system as executive director of the state's Children's Services Agency. This webinar is made possible thanks to the generous support of the National Institute for Healthcare Management Foundation, the Commonwealth Fund, and the Christy Hammam Fund for Health Journalism. We will be archiving this conversation later today at centerforhealthjournalism.org. A word about our format today. We'll be hearing from our speakers first, and then we'll turn it over to our audience for your questions. Feel free to share general comments in the chat. Because we have many people joining us on Zoom, we'll ask you to write your questions for our speakers in the Q&A panel. Now let's get underway. Roxana, your book, We Were Once a Family, tells the story of Jennifer and Sarah Hart and their 6 adopted children. Can you tell us a little about the tragedy that occurred in 2018 and why this story captured your attention as a journalist with a deep interest in the child welfare system? And what questions did you want to see answered that went beyond the breaking news story?
Sure. So at the end of March 2018, the Hart family was found at the bottom of a cliff in California in Mendocino County. And police at the scene quickly realized that it was not an accident. So Jennifer and Sarah were 2 married women, white women, and they had 6 Black adopted children. And reporters all over the country quickly scrambled to understand what was going on with this family and what led to such a kind of like unthinkable thing. Um, at that time, I was living in Houston, and I am a freelance reporter. I'm an independent journalist. So I was contacted by the Oregonian, which is the Portland daily newspaper, and um, they gave me a breaking news assignment to go to and knock on the door of one of the birth families who was from Houston. So the six kids, they three were in each family group. So they were two sibling groups of three. All six of them came from Texas, and they were adopted when Jennifer and Sarah lived in Minnesota. So that was already sort of unusual, that so many kids from Texas would be adopted out of state. Um, and when I knocked on the door of the first big birth family, the Davis family, I quickly realized that they were reeling not just from the like unthinkable murder of their children, but also they were sort of being re-traumatized from the loss of the children 10 years prior when they were first removed from them. So that was like their grief was really palpable and overwhelming. And so there was like a piece of it where I just realized immediately that this was a bigger story, um, that went back a lot further than what we were seeing. And over time, as I kept reporting, I got in touch with the other birth family, and this was 6 months after the crash. And uh, I reached out to them, and I realized that they didn't know, and that no one had told them. Um, so this was a huge national news story at the time, and people all around the country were tuning in to hear all of these really awful details of what the kids were experiencing. And no one had thought to call, no official had thought to call um, this other birth family to tell them what had happened. So, as someone who is already interested in child welfare reporting, um, I had been writing about the federal lawsuit against Texas for the failures of its child welfare system. So I'd been learning how to like access documents and stuff, because this is a notoriously difficult system to get access to documents from, because almost all of the case records and adoption records are sealed. So there was a challenge to me to try to figure out maybe how I can get some more information about this. And it was also important to me to uh, kind of start the story a lot earlier than I saw people doing around the country, who were very much focused on the white adoptive mothers and their sort of psychological motivations. To me, I thought that this was clearly a systemic story, and because it touched on various systems around the country, and these women had been investigated several times in various states, it seemed like a really good vehicle to tell a deeper story about the failures of the child welfare system.
Such a heartbreaking story. Roxana, you've written about how child welfare policy in this country tends to swing back and forth on a pendulum between doing more to keep families together and aggressive stances to remove children, often in the wake of a terrible incident. Can you tell us a bit more about that cycle, where we might be right now, and what that means for attempts to reform or even abolish the system?
Yeah. So, they say that there is a pendulum that swings. So, at some points there will be more attempts at family preservation. And then something bad will happen, probably a death of a child. We've all seen those stories, right? And often those are the only stories we see about the child welfare system, which is not so much about the system itself, but about, um, you know, failure to intervene or failure to remove a kid, and the disastrous consequences of that. And so, but the data shows that every time that some like a very significant news story hits, there will be a resulting wave of increased removals of children from their homes. And we know that the vast majority of kids are removed for neglect and not abuse. And so when we widen that net of removals, we make it harder to take care of the kids that we have in the system, because the system keeps swelling and swelling. But also we ensnare people in the web that don't necessarily have abusive home lives. They have other problems that are related to poverty or other reasons. So in 2020, there was, you know, in the midst of the Black Lives Matter movement, there was a push, kind of a mainstreaming of a call to abolish the child welfare system that has been led by prominent people in the field like Dorothy Roberts and Alan Detlaff at the University of Houston. And this was an attempt to kind of change the paradigm from this pendulum back and forth to maybe pushing into more preventative stuff, or even like help and support that is divorced from the child welfare system itself. So things like monetary support that is not based on conditions of compliance.
And you mentioned the lack of sustained reporting on the child welfare beat, or the lack of such a beat at many outlets, and the challenges that presents for smart coverage. For reporters who want to go deeper in their child welfare coverage, what advice might you offer, and what kinds of questions might they start with?
That's a great question. I think that we have a big problem, you know, with our coverage. I think, you know, journalism is contracting. And so I think we're asking reporters to do more with less. And that's an issue across the board. But there used to be a beat for child welfare reporting, and we're not seeing so much of that anymore. And, you know, not everyone is like at ProPublica and can spend 6 months on a story. So what I often see, you know, when I was doing this reporting, while I was working on my book, I would see a lot of, essentially it's like general assignment reporters are given coverage of maybe the lawsuits, because that's a big thing that reporters are often assigned to do. And instead of allowing that to be a jump off point for them to learn more about the system and how to cover it, it's sort of like a pass through, right? That every general assignment reporter does, and then gets assigned to a different beat, and a new one comes and has to learn. And it's a really complicated system to report on, partly because of the privacy laws that surround these cases, and also because, you know, these kids, a lot of them who are involved in the child welfare system long term in foster care, are very isolated. So they're difficult to access. And a lot of those kids that I've spoken to have been dying to tell their stories to someone. And, you know, the first and foremost thing I would recommend is to go to court. You know, the rules for open courts vary in various areas, but like in Texas where I live, you can show up at the courthouse and watch hearings. It can help you start understanding what it's all about. And it can also connect you to people who are going through the system, because those people do often want to talk about it. And it's just a challenge for journalists to meet them. And the other thing I would definitely recommend doing is start building your sources that are lawyers who are parents' attorneys and children's attorneys, because those people know the law inside and out. They know a million things about what's going on, and they often have a huge wealth of information about all the ways that the system isn't working as it should be.
That's great advice, Roxana. Thank you so much. Now let's hear from Ju Yun. Ju Yun, you have a unique vantage on the challenges facing child welfare and foster care in this country, having worked as a leader at both the federal and state levels, and now as a grant maker supporting promising initiatives and models. Can you give us a sense of how we got to this point, and your thinking on where we need to go from here to build systems that better address the needs of families and children before it's too late?
Sure, thank you. I'm going to share some slides just because I want to talk a little bit about data, and also share a little bit more information about a new initiative that we're getting to ready to launch, and why we're doing the work in this way. Let's see, are you guys able to see the slides? Okay, great. So we are launching something called Opt-in for Families, which stands for Opportunities for Prevention and Transformation Initiative. And the reason for that is because our system, we believe today, is really failing our families. And we think that not only is it failing to serve the vast majority of families who need help, but it's actually doing harm to millions of families unnecessarily. So let's start with a look at the data. Roxana talked about the pendulum of policies that emphasize keeping children together with their families versus removing them. This is just a snapshot of the numbers of children in care, in foster care, between the years of 2007 and 2021. It looks very dramatic because it's for a small range of numbers, but it does really reflect that pendulum. If it had gone as far back as 1977, you would have seen that we had 500,000 children in care at that time. The highest was in 2000, when we had roughly 550,000 children. And today we have 368,000 children in the foster care system. We have certainly seen a rise and fall within a range of roughly 550 to 250 children in care. And it really does vary based on what's happening in the news, what's happening in our culture, and the policies that follow it. Now, foster care isn't experienced equally across a child's lifetime. What we see is that the vast majority of children who come into the foster care system who experience child abuse and neglect are the youngest children, right? So birth to early childhood, and what you see is that that number then steadies out from pre-adolescence and then drops as kids get older. And then finally, the issue of race. This is a snapshot of the children who are in foster care for the year that we have the latest information, which is fiscal year 2022. And what you see is that the group that is most disproportionately represented in the child welfare system are Black children and Native American, American Indian, Alaska Native children, right? So not quite double for Black children, but I think if you include 2 or more races, you would probably get to a doubling. And similarly, for American Indian, Alaska Native children, double their representation in the general public. So this, in some ways, reflects why we are taking on this big bet at the Doris Duke Foundation. Jacqueline, you mentioned this earlier. You know, we think about the small number of children who enter the foster care system in any given year, but the reality is that this is an issue that impacts many, many more children. A third of all children will experience a pretty terrifying experience of an abuse or neglect investigation, and we know that that's half of all Black and brown children who will experience that. What makes that more unjust is that that sometimes that very scary investigation is the only thing that we offer families in need. We think that this often causes more harm than it does good, and we believe that there's a better, more cost-effective and scalable way to prevent abuse and neglect, which is underlying all of these policies and practices that we have before us, including the foster care practice. Oh, sorry. So what do we mean about the system doing more harm than good? If you think about the numbers of calls that you mentioned at the top of this call, there are millions of children, in fact, 7.5 million children reported to a child abuse and neglect hotline every single year in our country. Out of those 7.5 million children that somebody has raised the alarm, expressed concern, 5.5 million of those children will receive nothing. Will receive nothing. And what you see in these pie graphs are the moments in time when the state or the system fails to take any action to help children or families. The first and the greatest majority comes at that call to the hotline. Half of all of those children will get dropped at the point of the call. Now, on the one hand, if the only thing we're going to offer families are intrusive and scary investigations or foster care, that can be a good thing. But on the other hand, these families are signaling that they have a need, and we're failing to see those needs and meet those needs. The next stage is after an investigation. What you see is that nearly 2 million children are investigated every single year. Over 2/3 of them, that is the only intervention they get, is that intrusive, coercive investigation, and nearly half of all victims get nothing. We have a system that isn't working if the system is designed to help children and families. Now, one of the questions that we asked ourselves is, why isn't the system helping? Why don't we offer more families the preventive services that could benefit them? Now, for many decades, advocates, states, others argue that part of our problem was policy, that we were paying for the wrong thing, that our policies, by virtue of guaranteeing foster care and nothing else, was creating an incentive structure that pushed families into the foster care system because they lacked resources to pay for prevention services. Advocates fought very hard for a new policy that would, in fact, guarantee funds for prevention services. And Congress actually, in 2018, passed legislation that would do exactly that, that would guarantee funding for prevention services. And yet what you see in this graph is that 5 years after passage of that legislation, almost nothing has changed in the way we spend our funds. The vast majority of our dollars still go into those coercive, surveillance-focused investigations, the family separation that happens after that investigation, and then all the things that we have to do to try and deal with the repercussions of family separation and foster care. Everything other than that small blue box in the corner, right-hand corner, represents the old system. And we asked ourselves, why is this? We have the policy. We actually have lots of folks, like Roxana mentioned, advocates who are saying we need a different system, we need a prevention system, and yet things are still stuck in the old system paradigm. And what we realized was that what we lack is a system infrastructure that helps us to see and serve families early on. Everything that we've built for the last 100 years has been around seeing and serving families who we believe need foster care. And so that's why we've launched this demonstration project. I'll just quickly show you what this shows you on the left-hand side in blue is the way the system works today. We have reporters who are mandated to send any child concern to one singular agency, the child protection agencies, that's really designed to funnel children into the foster care system. We have a lot of community-based prevention resources. What we don't have is a systematic way of connecting families to the right service at the right time when there's an open slot. And as a result, families find that getting help becomes another hardship. And for many families, they get bounced around looking for help until they come back to the attention of the child protection system over and over again until eventually they lose their children to the foster care system. We think there's a better way. We call it a resource navigation hub. We think it needs to be part of our system approach to actually seeing and serving families in the community. We are working with a group of innovative leaders to try and find families who are not being served by child protection, who are getting screened out but have needs, to actually research and test ways to build out this community-based resource navigation hub that can connect families to services in their own communities. The hope is that if we can prove that this, in fact, keeps children safer, is cost effective and can be replicated, we'll have the information needed to actually send children directly from communities to community services and support. There are 4 pillars that we are researching. One is figuring out which families need this level of support. The second is figuring out how to engage them in voluntary services. There's been a lot of debate about which programs are approved for this new federal programs funding streams. It's an important debate. We need more programs on that clearinghouse so that we can reimburse people for different types of engagement. The sad fact, though, is that no matter how many programs are put on there, what the research makes clear is that we as a society do a terrible job of actually engaging families in voluntary services. The national average of engagement for these services is anywhere from 5 to 15%. If we don't figure out how, through research, to better engage families in services that they want and need, we are not going to be successful in keeping them out of the child welfare system. system. The third is that we believe many of these families who fall through the cracks today have complex needs, and we've got to figure out how to help them navigate very bureaucratic, siloed systems of help in order for them to get their full needs met. And then finally, we are very interested in understanding the nexus of poverty and child welfare involvement. We also believe that this is one of our policy gaps. We pay for lots of services, but we don't pay for the concrete and economic supports that could be exactly what families need to stay out of the child welfare system. We will be working with our 4 sites and their community members to design tests of change to see how services in combination with concrete and economic supports will actually keep them out of the system so that we understand which families need what kind of support for how long to safely stay in their communities and out of the child welfare system. I want to be really clear, though, that we are not doing a guaranteed income program. We are not trying to figure out how to end poverty in these communities. What we are trying to do is figure out how to stop poverty from being the reason a family gets pulled into the child welfare system. I'll just say that what we are doing is piloting, documenting, and then advocating based on what we learn in our 4 sites. And here's a link if you'd like to learn more about the work that we're doing.
Julian, thank you so much for that really informative presentation. We'll save questions for you until the end. I know a few just came in. Now let's turn to Sisto. Sisto, Think of Us, the nonprofit you founded, has as its mission to disrupt and rebuild an inequitable system. Your work is defined by people with lived experiences as children in child welfare and foster care systems. You've shared that you see their stories as an essential counterbalance to media narratives that can have a harmful impact. Can you give us a sense of some of the kinds of perspectives and insights that have been missing from policy and journalism, and how your work seeks to address that?
Absolutely. One of the things I loved about opt-in, where Ju was talking about, is that we cannot solve problems we cannot see. And I know that the initiative brought together parents to inform the design and how this might work. And one of the perspectives that we heard through that process was that parents had to make very tough choices. One parent talked about the fact that, she was going to be evicted, needed some housing support. She had been clean from and being supported by a nonprofit for 2 years, right? And when she went to the people who had been supporting her, the people that she had trust, the people who she had built a relationship to get the support that she needed, they told her, unfortunately, we can't help you with this housing need that you have because you've been clean for more than 90 days. And so if she was evicted, this parent, the children would be then at risk of being placed in the system. And so what she did was she intentionally relapsed, and she told that perspective. And that perspective opened up the thread around what actually tough choices do people make every single day to avoid the potential of their families being separated. Or she could have chose not to relapse. And then what would be the risk of child welfare, knowing that they're involved already, taking her children, right? And so that's a Russian roulette back against the wall situation. And so when we think about these stories, right, and these perspectives, it leads us then to trying to understand the 360-degree situation. Well, what's the eligibility there? Why is that? Was that federal money, state money being braided together that didn't allow that? What was the supports, that other supports that could have existed to address this, right? And so sometimes we have to really think about, how do we talk to the frontline worker, the fiscal person, all the different folks, while centering the experience of the people impacted to truly understand the problem? Because the problem may have been seen as, this person needs a housing support right now, but there is a larger underneath the surface problem around eligibility, around financing, and the complexity of people having to bring these different buckets of money together to actually turn around and say, here's how we can meet your need. And that level of complexity if you've been a reporter who is diving in and been assigned, and your boss is telling you got 3 months, 2 months, a couple weeks to cover something, then how deep do you actually are able to get to understand that complexity? And so that's what I would say is like the perspectives are so critical to having a role to play in understanding all of those different problems.
And in addition to advocacy and storytelling work, your organization also connects families with resources. Can you tell us more about the biggest needs that you see go unmet by the foster or child welfare systems based on the data you gather? Please share a few examples of the kinds of supports or resources that can make all the difference for a family trying to keep a child out of foster care. And why aren't public agencies doing more of this essential work?
Absolutely. So one of the things that we're doing in California, Georgia, and the greater Boston area, and more of our programs in California, is we are running a program called Virtual Support Services. And what this program is we have 10 frontline which call workers called community responders who are engaging with auntie, grandma, kin caregivers, engaging with current and former foster youth. And what they do is they answer the phone, read the email, look at the text message, and there's a request that's coming to us. And that request can range from I am needing you to support with utilities. I'm behind. I'm about to be evicted. I need food. I need a crib. I need a deposit for an apartment because I'm just taking in my sister's 6 kids. I mean, you name it. Some of those are things that there are existing benefit programs around and there are existing nonprofits around. Some of those things need a check like ASAP, right? And so what our service is meant to do is to connect folks to this, a service or to someone who's providing cash intervention. And last year we were able to serve 3,700 folks with just 10 folks. And the reason we were able to do that is because we did two things. Number one, we turned around and used technology at every front. How might we understand as much data as possible? So by the time we call you, we're not asking you, do you want help? We're saying, we've called Maria. Maria works from Monday to Wednesday. She already knows about your situation and 12 other people's situation like yours. If you call before 3 p.m. on Wednesday, she's already down to help, right? So being able to provide that excellent customer service so that people then want to engage, not wonder, are you going to be able to help me or not, right? And then the second thing that we're doing is we're not sitting here and doing a risk assessment, right? There are enough people who are doing that. Sometimes people are just going through so much, they just want to tell you what they need and believe them when they tell you and then just act on it. And sometimes that means we may have to come back a second time and figure it out, which is about 30% of the time. But that means we've built trust to actually just dive in and say, we're going to go ahead and do whatever whatever you tell us to do in terms of getting a resource. And then on the additional side, it's about doing the work. There's a lot of grunt work. You got to fill out this application, that application. There's a lot of emotional charge when you're trying to go ahead and say, here, fill out this question asking you what your problem is. Once again, tell your story, right? And so it is our folks on the front line that are saying, you know what, we're going to fill that in for you. We'll fill the application. Give me a couple of lines. Okay, our folks know just enough to know how much to put in there. And why do they have that nuance? Because most of our folks who are on the front line have some type of lived experience navigating a bureaucracy to get a resource. So it may have been housing, it may have been WIC, it may have been in foster care, right? And so they're able to understand that differently. This is how we have started to learn what does it truly take to create a service where people want to engage and people begin to trust that you can say, well, listen, I got a check for you today. However, I know this nonprofit and we have vetted that nonprofit. We have called, we've done the secret shopper model where we will call a nonprofit and act like we are looking for services to see how our family is going to be treated. Are they going to actually meet the need? Are they actually going to be responsive? How many days will it take? So that then when we send someone, we know for sure that they're getting a level of customer service.
So there have been a growing number of reforms in recent years, from the Families First Prevention Services Act of 2018 to last year's announcement from the Biden administration that aim to make it easier for families to receive financial support for taking in a young family member. States such as California and Texas have passed specific new reform laws too. But we also know bureaucratic norms and inertia can blunt the promise of new reforms. Do you see the needle moving in the right direction, and what are the biggest missing pieces in your view?
Here's what is so exciting to me. What I'm seeing is the emergence of different demonstration projects that are actually leaning into how do you solve the root issue of when adversity hits a child, a young person, a parent, how do you respond in the right way? How do you respond to the need versus how might we offer what a federal, state, and local budget allocates to provide intervention? And so when it goes from I have a shelf of things that I can offer you to what is it that you truly need, all of a sudden there's a different thing that can be created, right? And so when I think about opt-in, this initiative around 5 million children out of 74 million children who live in the United States today, who some type of flag has happened, and we do not as a government, as a society offering, hey, someone saw something, let's offer you something that you want to potentially engage in. We don't do that. So now you have this opportunity, this initiative here that is working on that. You know, for most of the country, placing children with people who might be related, who have to come into foster care, with someone who might be related or that the child knows really well, has not been the common practice. In fact, only 34% of children right now are placed with an extended family member when that child has to be placed in foster care. But now what we see with this new rule is the opportunity to say, how do we make it so that we actually are we actually are making that process easier? How do we make sure that there's actually money being delivered to support that family? These are practices that you might think, you know, were something that was in place, but they're not. And so, you know, we see the emergence of this in different places. The other place I want to name is, you know, we can have policy, you can have people who have the mental model, the narrative, the mindset, the attitude to say, we're going to do what we need to do to make sure we solve the root problem. But you need financing. And when I look at the financing structure in this country around child welfare, there is something that is truly fundamentally broken, especially in child welfare. For example, since 2016, you know, there have been about $200 million that the federal government has reimbursed to states around technology. When I look at how much is being spent on this new opportunity around around prevention, you saw that bucket that Drew gave, which was $183 million. The budget for the resource programs across the entire country for resource navigation is about $20 million. The entire budget of all the services that are given to states, the funding that's given from the feds to states for services for young people who are going to age out, is about $150 million. And so these have real implications, right, around how do we do this? So we talk about a system that doesn't have enough resources, but then we look deeper, and what we find is that there are buckets of money, but how are they being leveraged? What are we truly willing to pay for is a problem. And I'll give one more example. Um, in New York City, in 2015, 2016, there were two young children, a 6-year-old and a 3-year-old, who were killed. It was a Friday. The worker had gotten the approval to be able to remove the children. She looks in the child welfare system. She gets the address. She drives over to the home. It's the wrong address, right? So she can't get, you know, it's a Friday evening, IT's out, you know, she ends up then not going to visit. That Sunday, those children were beaten to death, right? This caused, again, the news to come in, report it. It's a horrific case. The Child Welfare Agency had been involved, had received multiple reports, and that social worker went out on that Friday, and guess what? They must have not, quote, quote, tried hard enough to do that. Now, the right address was in that case management system. but it was in this box over here versus this box over here. And so when the worker looked, they went to the address that was in this box. And so the result of this was that the commissioner at the time ended up resigning. There was $26.8 million that was added to hire up more CPS workers. But what no one asked themselves was, why in the world are the tools that workers who have to do this work every single day not actually meet the requirement here of supporting that worker? And when we look at how much was spent between 1998 to 2002 on this system called connections, it's $362 million. $362 million. In 2009, $166 million is allocated to upgrading this software system called Connections. And so when I think about this work and people talk about, well, it will cost too much money. People talk about, well, can we trust families with this money? It might go to waste. It is unfathomable to me that we would not spend the little bit of money that it would be super effective, as we're starting to see in these demonstration projects, but yet we would spend over almost what looks like $500 million since 1998 in a system that was built in 1994 and is not serving the actual needs of the social worker or the children in it.
Thanks so much, Cislo. I want to now turn to some reader questions. We have quite a few that have come in. For Roxana, a question from Jennifer. She says she covers child welfare and gets a lot of emails from parents who want to tell me how CPS wrongfully took their kids. I'm sure there are overarching issues with CPS, but it seems overwhelming to try to independently investigate each of their cases to see if there's merit. Any suggestions on writing on the big picture issues with the administration of child welfare without getting mired in the he said, she said?
Okay. So I have a couple ideas. One is that I think that people going through the system are probably your most valuable resource for understanding what the problems are with the system. I get what you're saying, that it's kind of overwhelming. Like, how do I make heads or tails out of a specific story? But the best way to start is to ask for documentation, but from the people who are reaching out to you. So that will allow you to start looking at court documents in the child welfare cases that can give you more familiarity with how it basically works. I think instead of looking at a big picture and going down, I mean, there's two ways to do it, right? So you can see if you can, I think that there's several very big issues that have received a lot of news attention. Like one would be medical abuse cases, right? Like I know in Texas was a really big series of stories about doctors in hospitals who were heavily reporting to CPS issues that were medical in nature, that, you know, sometimes abuse could cause, but other times there's a whole lot of other specific medical things going on with. That was an example, I think, of a big issue that a lot of outlets around the country started digging in on and finding like their own local angles. But I would say that like he said, she said it could be part of it, but there's also like the power of the state is behind one party, right? They are not on an equal playing field. And so if you start talking to parents and also their attorneys who can start helping you, you know, make heads or tails of like what the issue is. So if you can, you know, if someone reaches out, if you can get in touch with their attorney, if their attorney says, this is part of a thing that I see every day in the court, and, you know, you can start to make heads or tails of it that way. But I would always ask for documentation, whether or not you plan to, and, you know, don't say like, don't promise anything to them, but say like, I can take a look at the documents. The more documents you look at, the more you understand what you're even looking for. And that will help you ultimately write the story that ends up being, you know, needing to be told.
Thanks, Roxana. A couple more questions for you relating to how reporters can kind of take care of themselves when they're dealing with this really heavy subject matter. One question from Camille: I remember covering child welfare stories and my mental health being impacted by it. How do you take care of yourself through the reporting? And then one more question from Camille: how did Roxana prepare for her tough family interviews, and how did she handle not re-traumatizing?
Okay, great questions. I could talk to y'all about this for an hour probably or more. The first thing, I'll answer the second one first, I think. Preparing for the tough family interviews, I think the main thing is to um, be as sensitive as you possibly know how to be. So you're not using the same approach that you'd be using with a member of, like your the FLAC for the CPS, right? You have to sort of allow them to lead the conversation. You have a list of things that you need to understand, so names, dates, all of that stuff. I usually try to pick up everything that they're saying and write it down, like names, dates, etc. And then when they're not in the midst of their pouring their heart out to you, you can always circle back with them and get because when people are talking about traumatic memories, they're not always able to recall everything in the right order and on and on. So the first thing that you do is let them tell you what they want to tell you, and go at their own pace. So when you know the signs to look for when someone maybe has had enough. So maybe they start dissociating, or maybe they are getting really kind of worked up, or, just check in with them and let them lead the way. Some people want to just get through it. Some people want to take a break. Some people want 6 months. And I think the first like whatever story you're working on is not as important as someone's mental health. This can be life or death for them. Like, this is their history, and they're honoring you by sharing it. So that's how I feel. I think when it comes to taking care of yourself as a reporter, I think we overall need to do a lot better with helping reporters take care of themselves. There's a lot of beats that are really difficult to report on emotionally. I think kids is for sure one. I'm a mom, so there's an added element of just understanding the pain and suffering of a parent. I think, there's like the very obvious questions that I would love, you can email me too, because I can talk to you about that more in detail. But I had a therapist, I had a trauma therapist. You do your running or whatever makes you feel better. And you also have to have really good boundaries around your time so that you're not always constantly on and thinking about it.
That's great advice. Thanks, Roxana. We have some questions for anyone on the panel. One of them is there evidence of racial bias in child welfare investigations? Are Black families more likely to be investigated than white families? I wonder if there are more unfounded neglect, abuse allegations of Black families simply due to racist assumptions. Anybody want to?
In this country, as Drew mentioned, there are 7.5 million children who are involved with the CPS report. 33% of all families will experience a CPS investigation before their child's 18th birthday. 33%. And if you got about 7.5 million children, and there's 74 million children a year, 74 million children in the country, you're touching almost 10% of kids every single year, right? When it comes down to Black families, 53% of all Black families will experience a child abuse investigation. 53%. And then we go even deeper, 10% of all Black children will experience a removal and a placement within foster care.
Thank you, Sisto. Another question. Can each panelist answer the question, can or should the system we have be saved?
Who wants to go first?
I would say that we have to transform our system, right? The system we have is a binary system that says you either get the deepest end of the system or you get nothing. And that's simply unacceptable because the vast majority of our families are comprised of parents who love their kids and who are struggling with real life challenges. And we need to be able to actually see and serve them. And so I'd rather, I guess, focus on the need to transform our system into one that families actually need. It doesn't mean that there are never going to be serious allegations of abuse where we actually need the existing child protection system to intervene, but those are rare, right? What we need to do is build out a system for the vast majority of families who actually need a helping system.
I couldn't agree more. And so the answer there for me is like, no, it is, and the answer is transform. And the beauty of the word transform is that it is not abolish, it is not reform. It is how do you create something new that adds so much value that it makes the other thing obsolete. And so when we talk about a system that keeps families together, it's about getting resources when something early has been flagged. That is what the opt-in initiative is about, right? Leaning in with the right resource at the earliest point as possible to avoid things getting chronic to the point where there's family separation. When we think about foster care and shifting to a system that places with an extended family member, that is about keeping children safe with a family member that they know or someone that they know. And that adding, when we look at the science of how that adds value around less trauma, around educational outcomes, employment, you name it, it adds a different level of value. And so this is not about saving and reforming the current system. This is not about abolishing and leaving a gap in the system. What this is about is making sure that we create new parts of a system that then families can be able to go and leverage those parts of a system, and it adds more value. And then it's possible in our lifetime because the problems are so concentrated. 67 counties in about 11 states are responsible for 40% of the entries into foster care. This gives us a real, tangible, step-by-step opportunity to actually tackle this, have enough cost savings, redirect those cost savings to then figure out how do you serve even more families.
I think I like both of these answers. I think, you know, I think learning about the history of the child welfare system helped me understand it as an arm of the carceral apparatus that we have, that includes the criminal legal system. And it's sort of just dressed up in a way that makes it seem like it is really helping. I think what Sixco was saying, that is actually really smart, is that it's not saying that we don't need to support families, and it's not saying that abuse doesn't exist and it's not real, but it is saying that the current system that we have is not meant to help those families. It's meant to police them. I mean, that is really the when we see it in the lack of actual supports that we provide families in the system. So I think that, yes, I think that we do need to do a lot of different things, but I think the system that we currently have was set up to be a racist system, and it's doing as it was designed to do.
And Julian, we have several questions about your presentation, and just so the audience knows, we will be sharing her slide deck with everyone afterwards so you can access those numbers. I know there's a lot of interest here in these statistics. But Julian, there's one question. Are there statistics for how many children were removed from their homes due to poverty of their family? And what are the best sources for statistics on this system?
So one thing that I'll share is it's hard to say a percentage of families removed for poverty, but a lot of people talk about how neglect is another way of describing poverty, perhaps plus something else. One of the statistics that I often share, because I think it's really important because these two things often get conflated, is that most poor people do not abuse and neglect their children, and most poor families do not get involved in the child welfare system. However, most families involved in the child welfare system are poor. And so this is why we need research and evidence to understand that relationship. Is it at a moment of particular material economic shocks, plus something else going on in the family dynamic, like domestic violence, that makes a family then more vulnerable to get into the attention of the child welfare system? These are the things we need to understand so that we can then move upstream and provide ways to help those families in those moments of hardship. So I would say, every state defines abuse and neglect differently. Every state records the different contextual factors that might exist when they check the box of neglect, but there isn't like a national data set that can show you that. But we do know that most families involved in the system are poor.
And Julian, there are a couple questions
I
just
guess,
about.
can I add one little thing to that?
Yeah,
Because
go
I
ahead.
think I've found in my reporting that sometimes they do not take the data for things that they don't want to know the answers to.
Sure. Yeah, absolutely.
And I think about like LGBTQ children in foster care. There is a serious lack of data that could be used to help secure more safety for them. And this is something that they fought for and and they did pass it federally. And then Trump took it away, and it's mired in this 10 years of drama. But ultimately, if you don't have the data, you can say, we don't know. And then if you don't know how big of a problem it is, it's harder to solve it.
You can look at proxy measures. One of the things that we know from the data is that 1 out of 4 children in foster care are there due to reasons related to family homelessness. So that we do have some proxy measures that show the impact that poverty has in child welfare involvement.
And one question for you, Julian, regarding one of the slides, why is the rate so high in the under 1 age group? Is there more neglect and abuse?
I think that this is a population that those who are in the kind of mandatory reporting world are particularly concerned about, right? Infants can't talk to anyone. They rarely are in line of sight to other communities. And so I think people are just much more sensitive to concerns that they see for very young children. We also, have to acknowledge that there are some communities where they believe that if a baby is born substance exposed, that automatically is defined as a concern that needs to be reported. And so there's just a lot of variation, but I think one is that there is just community concern for very young children for valid reasons.
And what are the 4 sites for opt-in?
So it's state of Oregon, Kentucky, Washington, D.C., and South Carolina.
Okay. Let's see, another question here. Can a child in foster care's attorney be part of the preventive solution?
I actually think legal representation is a major part of the solution. Like we've all said, many of these families probably are entitled to benefits they aren't able to access because our bureaucratic systems of help are so cumbersome. And so we know that for families who are already system involved, legal representation can be a way to get out of the foster care system because it helps families not only fight the child welfare system, but also access services that will help them get their needs met. And this is certainly true for further upstream as well. We need to make sure that we are giving families the resources they need to get the services and supports that they may be entitled to.
Julian, one more question for you. You shared a graph showing the number of foster children has declined in recent years. Why is this? And where are these kids going if not entering the foster system?
Yeah, it's a good question. I think it's a question we all have. I think part of what we don't know yet is how far that graph will continue to decline. It could be a combination of a lot of things. We saw that the number of reports to hotlines significantly decreased during the pandemic, particularly when we had periods of lockdown where there weren't people actually seeing kids and therefore not able to report them. What was exciting and why I think this is a moment of transformation evolution is we learned that even though people weren't seeing and reporting kids, we didn't experience significant harm to children, right? And I think it taught us collectively that maybe economic supports, maybe being able to spend more time with children were actually protective factors that we need to think about including into our system response.
One of the things I just want to hit on here too also is that we've seen an evolution over the last 40 years around the role of nonprofits. And we've also seen an evolution around how the federal government and states have invested in nonprofits trying to solve part of the problem. And so one question I have and a story that I would love to see is the investigation of like what has been the effect of money flowing to community-based organizations to respond. And what we do know is that during the pandemic, we saw the spike of nonprofits answering the calls, and we saw humans in community answering the calls to be able to say, how do we help in this moment? And so is there, a buffering, a promotive and protective effect when nonprofits are able to step up and we're able to have the capitals to act fast? And that is something that I think is worth digging into. And what encourages me again around June, your work is around how is it that you're relying on the community to actually be able to be responsive to the needs of those folks who are getting no services right now.
Well, we're out of time, folks. Thank you to Ju-Yun, Sisto, and Roxana, and to the audience for all your great questions. We'll be sending you a survey asking for your feedback on today's program and for your ideas on other topics of interest. Please take a moment to complete it. We'll be archiving this webinar a little later today at centerforhealthjournalism.org. Thank you so much for joining us and have a wonderful day.